This is a CJSON podcast, and I am Silvi Shah from the University of Cincinnati, lead author of the study, Mortality and Recovery Associated with Kidney Failure due to Acute Kidney Injury in the United States.
I am Charuhas Thakar, senior author of the study from the University of Cincinnati. Acute kidney injury requiring dialysis is a contributor to the growing burden of kidney failure. Little is known about the frequency and patterns of recovery of AKI and its impact on outcomes in incident dialysis patients.
Using the United States Renal Data System, we evaluated a cohort of about 1 million dialysis patients from January 2005 to December 31st, 2014, retrospectively. We examined the association of kidney failure due to AKI with the outcome of all-cause mortality and the associations of sex and race with kidney recovery. Mean age of our study cohort was 63 years, and 3% of patients starting long-term dialysis had kidney failure due to AKI. Compared to kidney failure due to diabetes mellitus, kidney failure due to AKI was associated with a higher mortality in the first 0 to 3 months and 3 to 6 months following dialysis initiation. Of the patients with kidney failure due to acute kidney injury, 35% eventually recovered their kidney function, 95% of those within 12 months. Women had a 14% lower likelihood of kidney recovery than did men. As compared to whites, blacks, Asians, Hispanics, and Native Americans had lower likelihood of kidney recovery. In conclusion, we report that kidney failure due to non-recovery of acute kidney injury confers a significantly higher adjusted risk of death for the first 6 months as compared to kidney failure due to diabetes or other causes.
Over a third of patients with kidney failure due to acute kidney injury will recover kidney function, with the majority of them doing so by 12 months. Moreover, the likelihood of kidney recovery was lower in women than in men, while compared to whites, it was lower in all other racial categories.
Our study suggests the need for developing customizable treatment strategies for patients with kidney failure due to acute kidney injury, in particular focusing on factors promoting kidney recovery.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.